When someone is seeking professional help for a psychiatric disorder, such as for major depression, or for complex PTSD, or for a borderline personality disorder, they're usually at the end of their tether. They feel very distressed, possibly hopeless, and most likely ashamed of being in this situation, and therefore might be hating themselves. What we know from research is that what helps clients across the board is to feel felt by their therapist, and to feel like they have a caring ally by their side with whom they can work towards a common goal. These common factors are much more important in explaining positive therapy outcome than any technique we might use. They are the very foundation of any effective psychotherapy. So how do you make your client feel felt? How do you become that caring ally or that loving rock to them? Opening to somebody else's pain causes empathic pain, which is stressful for anyone. Whilst under threat, we automatically act in egocentric ways to make ourselves feel better. This is not our fault. Thanks to neuroscience, we know that compassion is a distinct emotional state which energizes us and protects us against burnout and malpractice. Mental training can help us to turn on the neural networks involved and shift from empathic pain to compassion. Compassion is the state in which we can empathize and mentalize at the same time. And not just that. Research has found that compassion is linked to interoceptive awareness. Interoceptive awareness helps us to receive bottom-up signals from our bodies. It allows us to feel the sensations inside our bodies, such as breath, heartbeat, or the movements of the viscera. It also helps to be aware of top-down processes such as our thoughts, biases, beliefs, attitudes, and our emotions regarding those perceptions. Interoception is needed to have a sense of self, to notice and regulate emotions, to make decisions, and to control our behavior. And without being able to feel our own body, we will struggle to feel another's pain or pleasure. In short, it is an essential clinical skill. Secondly, the reward system is activated when we feel compassion. Subjectively, people report positive emotions such as warmth and kindness towards another, and a wish to approach them and be ready to help if necessary. Thirdly, the theory of mind network is activated during a state of compassion. This network is involved in inferring the mind states of others and in reflecting on ourselves. When we are in a state of compassion, all three components are involved. In real-life clinical situations, we move through a dynamic process that starts with empathy and ends in full compassion. By listening to the client and tuning into their facial expressions and tone of voice, we pick up their emotions. If we're open to them, we will feel some of their pain in our bodies. This is called empathic pain. By feeling into our bodies, noticing the unpleasant sensations, and maybe taking some deep breaths, we begin to regulate the distress so that it doesn't overwhelm us. By focusing on a part of our body that is free from empathic pain, we create space around it in our body and feel more at ease. Secondly, we use our perspective-taking skills to understand that we are in fact fine, but that we're merely mirroring the distress of our client. This helps us to relax around the empathic pain instead of trying to fix it or resist it. We can then try to put ourselves into the shoes of our clients, to understand what it might feel like to be them, and why they might be feeling the way they are. Now that the empathic pain is no longer flooding us or triggering our safety mechanisms, we can use it as valuable information on how the client feels. These are the data we need to make someone feel felt. Perspective-taking skills also help us to recognize our own patterns of emotional activation. If we know ourselves well enough, we are less likely to react in an unconscious way, and we are better able to understand our clients. Over time, our perspective-taking also includes our clinical knowledge and clinical and life experience. This gives rise to increasing wisdom. Thirdly, we need to recruit our care system. Sometimes we struggle to feel caring towards a client, so it is important to learn to evoke this caring intention in a genuine way. In the same way that we need to feel our bodies to feel the distress of our clients empathically, and in the same way that we need to know and accept our parts to understand and accept the client's parts, we need goodwill towards ourselves to develop genuine and lasting goodwill towards our clients. Activating the care system is what generates positive emotions and thereby gives us energy. The process could be compared to someone dropping a pinch of salt into a big lake. The pinch of salt is the empathic pain the therapist feels in their body. If the container is small like a glass, then the water becomes contaminated. If the container, however, is spacious enough like a lake, the salt will not affect the quality of the water. It will still be drinkable. We are calm as we can hold any distress. We feel confident because we trust in the psychological resources. We feel connected to ourselves and to the other in a caring and loving way. We feel courageous and committed to the joint adventure of therapy with its many unknowns. Our mind is clear and creative. Compassion can be defined as the rainbow that emerges when the sunshine of goodwill and trust and goodness meets the tears of suffering. As we grow in compassion, we grow in equanimity. Equanimity could be defined as the heart that is open to anything. We can turn towards and welcome all kinds of parts and feelings in us and in others. What helps us to turn towards both pain and pleasure is that we begin to learn that all experiences eventually shift and pass and make space for something new. Life is constantly changing, and so is our experience. This does not make us feel hopeless, but instead creates a deep sense of trust. Equanimity makes us humble as we learn to see what is within our control and what is not. As we become more humble, our egos shrink. We are less dependent on the approval of others, yet still highly ethical and responsible. This makes us more courageous and proactive in our caring, meaning we are more likely to stand up to harm and injustice. Compassion can therefore make us both nurturing and allowing, which might look more passive on the outside, as well as courageous, fierce, and strong, which will look more active on the outside. A nurse or paramedic manifests their compassion mostly in practical and active ways. As clinicians, we tend to manifest the more receptive aspects of compassion because our job is to empower the client. Nevertheless, in a state of compassion, we are always ready to help in an active way if necessary. Being fit in self-compassion means being able to own up to the fact that we are real, vulnerable human beings who, despite a few degrees under our belt, sometimes struggle and make mistakes. Embodying common humanity in an authentic and professional way also helps to dissolve the common projection that the therapist is somehow superior or free from pain or failure. It also encourages a transparent and collaborative way of working between two equals. So how about we get started with building the kind of therapist you might want to become or want to be more often?